Good evening to everyone and welcome to today's session. Yuddha Kshetre Kurukshetre. Good evening to everyone and welcome. In the modern time, the NEET PG is also like a Kurukshetra, where there is an intense competition in NEET PG with 1,60,000 aspirants with a great dreams and hardly 20,000 seats being available is a real rat race that we are living in. But there is a way. There are not more than 1,000 topics that you have to emphatically prepare. 650 you need to have a super focus. From that 650 out of the 1,000 topics, the 300 MCQs ultimately are going to come in the NEET PG. So it's all a question of knowing what are those 1,000 topics, super focus 650 topics, and hitting the bullseye of 300 questions correctly and getting 1,000 plus score in the tomorrow's NEET PG. That is all our endeavor for the next 6 months. I am very happy to see 20 plus online students. On every Thursday, we will discuss the most recent 2019 question papers. So let us take up the NEET PG pattern 2019. Actually, examiner, what did he ask? Can the online students can punch whether the voice is loud and clear? Yes. Umbilical dermatome is located in which level? Is the examiner's question. It is in the T10 is the dermatome. So you can easily remember. How you remember is most important, doctor, ultimately. Nipple. You can remember tit for tat. Tit as in nipple. For, T4. You can remember. Then umbilicus. What is umbilicus? Belly button, 10, button. So you can remember umbilicus as the T10 is considered to be the typical dermatome of the umbilicus. So if you look at the various structures, C1 is the arm, C2 is the forearm, C3 is the palm, and C4 are all our proximal phalanges, and C5 is middle and distal phalanges. A very easy way to remember. Another way examiner can ask you, the way he asked in the NEET PG. Good to see Roshan Yadav and many more online students who have joined the today's class. You can directly click on that YouTube button and it will land you in the chat window. You can always come down to the YouTube channel to also attend it. But we want students to enroll. That's the reason we are trying to get you. You enroll, at least register, and then attend this free class. C1, C2 is flexion. C3 is lateral flexion. And C4 is shoulder elevation. C5 is shoulder abduction. C6 is elbow flexion. C7 is elbow extension. C8 is thumb extension. And T1 is finger adduction and abduction. So a neurologist's job is like a carpenter. You do the typical testing by checking all the shoulder abduction, etc., motor function. If it is impaired, then it localizes the lesion to that particular root value in the spinal cord. So that's how you work like a carpenter. So C8 is little finger. T1, T2 is inner aspect of the arm. and T4 is nipple, tit for tat, and T7 is the inferior border of the scapula and the tip of the xiphoid, and T10 is the umbilicus, and L2 to L3 is the anterior thigh, and S1 is the heel of the foot, is what you need to remember. So this dermatomal patterns is a favorite question of the examiner doctor. Now, internal capsule or which type of fibers was the NEET PG examiner's favorite question, most recent 2019. So, they are called projection fibers. So, doc, what are association, projection, commissural fibers, and what are the classical examples of each of these different types of fibers is very, very important to remember. Association fibers, they connect different cortical areas of the same hemisphere, same within right hemisphere may right, left hemisphere may left. Within the same hemisphere, they connect different cortical areas. Commissural, they cross across the midline and they try to connect one hemisphere to another hemisphere, one area of hemisphere to the other. Projection, they leave the cerebral cortex and connects to all the subcortical structures. Below the cerebral cortex, you have basal ganglia, thalamus, brainstem, spinal cord, everything. So obviously, what is internal capsule? Internal capsule is the one which is basically connecting the cerebral cortex down the corticospinal tract, is passing down through the towards reaching spinal cord. So it is leaving the brain and going down. So that is the reason it is a projection. It is projecting down towards the brainstem. So that is a point you need to remember. So what is the largest commissural fiber? Commissural fibers are connecting wide areas of both hemispheres across the midline. So typically the corpus callosum, the largest band of the commissural fibers is what you need to remember, where it connects the various areas of the neocortex except the anterior and lower parts of the temporal lobe. Then corona radiata, internal capsule, and these are the areas which are called projection fibers. Then you have anterior commissure, posterior commissure, hippocampal commissure, habenular commissure in the limbic system. They are all the examples of commissural fibers is what you need to ultimately remember. So the NEET PG questions are very simple. A good number of them are all single liners, right? So there is no very big USMLE kind of a challenge is not really there. There are few image based questions, but they are very easy to crack. Provided you know what to read, what to focus, what to have the depth, what are the topics where you need to have depth, and you should expect, anticipate and kill it. It should suddenly not come like a surprising Yorker, right? Now, uvulae vesicae, how is it formed in the prostate gland? So it is the median lobe of the prostate gland which leaves a projection within the inner surface of the bladder. If you cut the bladder, bladder is like a bag. You cut the bag, inside the bag, kya milega aapko? Typically, you have an internal urethral sphincter, your internal urethral orifice, from where your urethra begins and then ultimately urine passes out. And in the bladder, you have the opening for the ureters. Then this is called the trigone of the bladder. And there is a typical uvulae vesicae. It is typically just above the internal urethral orifice, and in men it is produced by the median lobe of the prostate, is what you have to clearly know about the anatomy. Good to see Satya, Roshan and many more online students. Now, right coronary artery, from where does it arise? Keep punching your answers, doctor. If you are also punching answers into the chat window, you feel interactive. That is most important thing. You keep guessing the answers and punching the answers. So nowadays, live online became more easier than face to face. Anywhere in the country, anywhere you can sit and happily enjoy a live session and also chat. So after 4 or 5 years later, face to face classes become a history. Still they are there, but yes. Good to see Shivendra Rai, who is online. So doctor, right aortic sinus. From that the right coronary artery arises. So doctor, here we have to draw a little bit diagram. Anatomy is all about the diagram, right? So you should have a mental picture as to how it basically looks like. So fundamentally it is a circle. Remember the Mercedes-Benz sign. So you have a right aortic sinus and a left aortic sinus. And here you get two vessels coming out of the right aortic sinus. There is a right coronary artery and there is a left anterior descending artery and left circumflex artery. So they both arise basically from the right aortic sinus. Whereas you have the left aortic sinus, nothing arises from this. So you should always remember right aortic sinus is the one which mainly gives rise to the coronary arteries, both the coronary arteries. That is the point examiner is specifically asking you whether you know or not, and this is the area where you have the pulmonary artery. So doc, I leave this PowerPoint for you to do the revision, and yeah, so those students who are online, you can click on that YouTube button. So you will land in the YouTube channel, and that is the place where you can be able to participate in the chat. Yes. Now doc, right coronary artery, 3-4 points fatafat bolo, arises from the anterior aortic sinus of the ascending aorta. It descends in the right atrioventricular groove, and near the inferior border it continues posteriorly along the atrioventricular groove. It goes behind posteriorly, and it will anastomose with the left coronary artery. These are the few things about the right coronary artery. This external oblique aponeurosis, it has a lot of ligaments which form as a reflection of this aponeurosis. So what are all those ligaments? Inguinal ligament, pectineal ligament, lacunar ligament, they are all the ligaments which are the reflections of the external oblique aponeurosis. So the inguinal ligament का दूसरा नाम क्या है? Paupert's ligament. Lacunar ligament is called Gimbernat ligament. Pectineal ligament is called Astley-Cooper's ligament. So these are all the things that are basically the reflection of the external oblique aponeurosis. Once more doctor, in our 1000 topics that we are giving you in the 120 days, 600 hours regimented course, one of the topic is inguinal canal, favorite topic of the examiner. You can't get rid of few things. Hernia, you should understand clearly. Inguinal canal anatomy, you should understand clearly. What is direct, what is indirect hernia, what are the differences between the two, and how are you going to operate a hernia. So there will be 50-60 common single liner questions on this important topic. एक बार आप वीडियो रिव्यू करके MCQs in the AIMS PG Exam in all these exams, एक बार if you do the revision on the online mbbs.com video library, automatically you know the game, doctor. One round up 120 hours, 120 days, 600 hour program offers online में एक round revision करो, 600 hours के बाद you become महाज्ञानी, right? You yourself can start giving coaching to your classmates, right? It's a very easy game, simple game. Just spend 5 hours every day by subscribing to the online mbbs.com video library, and every day whenever we have the live class, participate and get a good revision and be active for the next 6 months. So doc, this is the typical linea alba, the central part. This is the pubic crest. You can see this is the pectineal ligament, the lacunar ligament. A sub cheese, they are all the reflections of the external oblique. Aponeurosis is what you need to understand. Now doc, what is this structure which is transmitted through this foramen which is being depicted? Very easy question, biscuit question. मैंडिबल को दिखा के फोरामेन दिखाए तो वो मैंडिबुलर फोरामेन होगा. मैंडिबुलर फोरामेन से जाने वाला नर्व inferior alveolar nerve is the one which passes. So if this is the mandibular foramen, you have a inferior alveolar artery, inferior alveolar nerve. Baju mein you are having the lingual nerve. These are the things which you need to understand. Now 3-4 points we should learn about it, because NEET PG examiner is very hot about the lingual nerve and the inferior alveolar nerve. So let us be very sure. What do you want to remember? 5 points about lingual nerve. Lingual nerve is joined by chorda tympani. Chorda tympani. And it enters in very close relationship to the third molar tooth. That's a point you need to remember. And what is the purpose of lingual nerve? It carries the general sensation, the hot, cold, touch of your tongue while you are giving a French kiss. They're all, lingual nerve is actually kissing, doctor. You are only a Frenchman. The real kiss is enjoyed by the lingual nerve. So, general sensation in the anterior 2/3 is what you have to remember. Right, doc? And lingual nerve also should be remembered for 2 things. Will you only kiss? You will also salivate. So, who salivates? Sublingual glands, submandibular salivary glands. It is the lingual which provide the parasympathetic supply. So lingual is a romantic nerve needed for a good French kiss. General sensations in the anterior 2/3 of the tongue, and sublingual and submandibular salivary glands parasympathetic innervation you should not forget. Many times we discussed this. Then inferior alveolar nerve. What is the importance of inferior alveolar nerve? Is there any motor supply provided by it? Why is it passing through the mandibular foramen basically? So mylohyoid nerve is one which is the branch of the inferior alveolar nerve is what you need to remember. So what does mylohyoid basically supply? It supplies mylohyoid muscle. Badi baat nahi hai, but very important. It is the one which supplies anterior belly of digastric muscle, doctor. This is the most frequently asked question. You have to remember. And ultimately, The inferior alveolar nerve also gives at the level of the mentum a sensory branch called mental branch. So it is the one which supplies the typical sensation in the area of the chin. If you like a little kid, you will hold the chin and say, "Good, nice song" on the stage and tap on his cheek. So the chin is what? The mental branch of the inferior alveolar nerve. ये दो points future NEET PG exam के लिए आप याद रखना पड़ेगा डॉक्टर. Now